Zika is a viral infection that causes fever and rash, and it's spread by a certain type of mosquito. There's a lot of Zika currently in South America and Puerto Rico. And we've had approximately 2,000 people with this infection come back into the United States. Now, these people, once they get back into the United States, there's the ability for them to infect the same type of mosquito that we have here in the United States, and then those mosquitoes can spread infection to other people who've never been to South America. And for the most part, for over 90%, 95% of people, it is an extremely mild disease. The majority of people don't even have any symptoms at all. If they do have symptoms, it tends to be a fever, a rash, a headache, usually some red eyes. However, as Zika has spread explosively throughout South America, we've learned that occasionally, even in adults, this virus can cause a severe weakness and a weakening disease, a paralysis-like disease. So there are some complications from having Zika virus that can be severe. The biggest complications, however, are in the case of pregnant women, where we do know that this virus essentially acts as a guided missile for a baby's brain cells, and they can have very severe birth defects or even potential spontaneous abortions and potentially long-term effects. Zika is a very interesting mosquito spread infection because it can be spread not just by mosquitoes, but it also can be spread by sexual transmission. And this has probably been going on for a very long time and has never been recognized because people just assumed that you were infected by mosquitoes. But now that people can so readily travel from one area with these mosquitoes to areas without these mosquitoes, we have now seen transmission sexually, generally from men to women, but now there's even a report of a case of a woman who was recently infected, who spread infection to her partner who had not been at some place where there was Zika virus. So this is why we recommend that people who come out of areas where there is Zika, that they take appropriate precautions with condoms and contraceptives to keep from getting infected, and also in the case of women, to keep women from getting pregnant and having their babies infected with Zika. Zika is caused by a virus, so there's no antibiotic that's going to help. So the treatment is all very much towards the symptoms of what will make you feel better, Tylenol, fluids, etc. The good news is that outside of the sexual transmission, which can occur for a couple of months in the case of men, once people recovered, they have recovered. And so if you're a woman and you've been infected in the past, once you've completely recovered, you should be able to have a baby without any side effects from Zika. Zika will not become an epidemic in the United States. The type of mosquito that spreads Zika tends to be in Florida and the Gulf Coast and Texas. So it's very important for pregnant women to be careful if they are traveling to those areas. Across the United States, your public health officials are being very, very conscientious, and they are monitoring the types of mosquitoes that occur across the United States and keeping track of any additional any additional cases that may occur as a one-off in the United States, so we can continue to protect health in the U.S. For more information, please go to the CDC website, www.cdc.gov.